Greetings, I'm Dr. David Reetz, current president of the Association for University and College Counseling Center Directors. I'm here with my colleague, Tom. Tom, would you like to introduce yourself?
Hi there, thank you. I'm Tom Coté, Executive Director of the Association for University and College Counseling Center Directors. We are very honored and enjoy the privilege of being here today and appreciate the invitation. You'll hear a little bit more from me later, but for now, back to Dr. Reetz.
Thank you, Tom. The changing landscape in higher education and mental health. Boy, has the landscape changed. You know, it's something we can all relate to. College mental health service delivery in the COVID era. The COVID era has really brought on profound demands on all of higher education. It's put demands on colleges and universities to take measures to reduce the transmission of the virus among not only students, but employees. We were tasked with reducing the density of people in physical spaces across our campuses, to revert to virtual learning away from the classroom, and revert all of student services to a virtual environment. Profound change on the kind of scale that was required. And we want to take a few minutes to talk about what the Association for University and College Counseling Centers has been doing to address those immediate needs, and what we are doing in general as leaders in college mental health. We are here to advance the mission of higher education through innovating, educating, and advocating for college mental health. We have a sharp focus on counseling center director development, and we are most certainly committed to inclusive excellence and social justice. We currently have a membership of nearly 1,000 colleges and university counseling center directors, as well as 150 retired and emeriti directors. We have all types of institutions across higher education in 12 countries, private, public, community colleges, and specialty schools. One of the tools that we use to understand the landscape in college mental health and the changing landscape is our annual AUCCCD Director Survey. It's the largest ongoing database of counseling center policy, practice, and service trends. We examine all sorts of things from service models, utilization rates, salary trends, staffing. We also really try to keep the survey nimble and flexible to emerging issues and needs. And certainly the pandemic brought us emerging needs. Here's just a few examples of what we've done with our survey to understand what counseling centers were doing differently in response to the COVID and need to transition services. The most recent survey, we had 478 colleges and universities represented with a wide range of types of institutions. What we learned is from July 1, 2019 to March 15th, 2020, the use of telemental health service was minimal. Up at the most, 20% of services were being delivered on some virtual platform. Between March 16th, 2020, when campuses started to close down, to June 30th, 2020, counseling centers were now averaging over 90% of their services were delivered through telemental health means, representing a significant change in our service delivery models. Another example of an item we were asking about is which platforms were being used for telemental health. In our survey, about half, almost half, were using Zoom for healthcare, and then a whole host of other platforms by a smaller represented sample of college and university counseling centers. A few other things we learned from the counseling center directors, which also represents one of the more significant issues that we've continued to try to face, is the licensure limitations and regulations, at least in the US, between states. Before the pandemic, 7% of counseling centers were able to provide some type of clinical services to students living out of state. However, with the pandemic and the national emergency that were called, many regulations were loosened that allowed us to serve students across state lines. And we were able to, 57% of counseling centers indicated that they were able to provide clinical services to students living out of state between March of last year and June of this year. Some of the delivery models, as I said, telemental health had become the dominant service model within the COVID era. And we had to meet the challenge of navigating the state level regulations. One way that we did that is that we thought of other ways in which we could be helpful for students that wasn't necessarily through regulated clinical services, and which allowed us to think about a variety of other support services that we could offer. Support for students that were reporting higher levels of isolation and being put into quarantine. And there were particular students and populations that we were identified as being at greater higher risk. Certainly students in an LGBTQA+ population having to return home and navigating those complexities. We're an at-risk population. Our BIPOC students, international students, and student athletes, just to name a few, were students that we were attempting to provide some additional supports to. One last thing that we had to do was also redesign our space, not only to create social distancing, but moving students to the telemental health platform necessitated us to provide some of those students with the private and confidential space they needed to have these sessions. So we reconfigured some office space to allow students to come into those offices by themselves and log on and have that telemental health session with their provider. What we've learned about the satisfaction outcomes, talking to students about these services, we found there's no difference in the satisfaction between in-person and remote services. We found no difference in the functional outcomes between in-person and remote services. We found no difference in the clinical outcomes between in-person and remote services. One thing that we have learned is that the no-show rate is slightly lower with remote services, and we can certainly explain that in a variety of different ways. And lastly, as an organization, we've been really committed to deepening our work in the higher education arena and deepening our leadership. One way that we've done that as an organization is to unanimously support a dues increase, specifically so we could hire our first executive director. And we were very deliberate in looking beyond ourselves and looking beyond our own knowledge and expertise and seeking out someone that had particular skill in the association management and nonprofit space, which leads me to hand things over to Tom. Tom, take it away.
Thanks so much. Again, I'm Tom Coté, the new executive director. I've been on board since October 1st of 2020. Very happy to be here. I bring knowledge in the mental health association space, as well as lots of background and experience in lobbying, advocacy, operations management, and diversity as well. And so I'm just very happy to be partnered with this organization, especially at this time. One of the things that executive directors truly believe in is a strategic plan, and it really helps to communicate goals between a board of directors and an executive director. And so one of my main goals coming on board was to take the former plan for the association, build a kind of a bridge plan to get us out of the pandemic, maybe tie up some loose ends from the former plan, and also set us up for growth in the future. And so what you see in front of you are our goals for our new bridge plan that we just put together a couple of weeks ago. And really what this does is, again, it bridges us between hopefully the end of this pandemic and into the future of growth for the association. And so I'm just going to run through these very quickly. But goal one is to address director development across the professional lifespan. So this is just making sure that we're meeting members where they are and ensuring that we're always developing our members to stay in the profession and make sure they have the tools to do their job as to the best of their ability and treat their patients as well as their communities in a strong way. Goal number two is to increase member engagement across the professional lifespan. And this is really to ensure that our organization continues to be a member-driven and member-led organization. And so we want to make sure we're communicating opportunities for members to engage. We're ensuring that our structure to communicate information that is important to members, both internally and externally, is also very efficient. We want to make sure our website really speaks to what our members need, what future members will need, as well as others in the higher ed space. When they come to our website, they can really get the information that they need. And then, of course, our director's survey, which Dr. Reetz alluded to earlier, we want to make sure that we're always advancing that as well. Goal three is to evaluate and promote the association's structural integrity, equity, and health. And this is really just to ensure that our association has other non-dues revenue streams, is ensuring that our committee structure and leadership structure, our leadership pipeline, there's no barriers to joining our community, to volunteering for the association and to serve in a leadership capacity. And this will take some work in terms of looking at our governing documents and ensuring that they're modernized. Goal 4 is to advocate and be leaders in the profession of collegiate mental health. And so for us, this is ensuring that we have strong media contacts, that we are ensuring that we can move our information to our external relations as well, and that we can also ensure that our partnerships with other organizations is very strong, and there are goals associated with that as well. And then goal 5 is to equip members to serve as campus and system-based advocates for collegiate mental health. And this is really I think our biggest area for growth in terms of making sure that all of our data is really spread out to and communicated out to all those in our industry, as well as those folks, the decision makers on all campuses, as well as our legislators, because there very well could be policy advancements and policy development that we could lead to ensure that our college students have all of the help that they need and have sound mental health on campus. So those are just highlights of where we're going with our strategic plan. And we're really, again, very thankful to have you here listening to us today and for the opportunity to participate in the conference. If you have any questions about the association, please feel free to reach out to me. Our contact information, or Dr. Reetz, our contact information is on the next slide. We're really interested in hearing from you, especially if you're interested in becoming a member, you're interested in volunteering or participating in the association, we're happy to have you. So I'll thank you again, and I'll just allow Dr. Reetz to close it out.
Yeah, yes, thank you, Tom. And thank you all for your kind attention. Please enjoy the remainder of the conference, and we certainly look forward to hearing from you. Stay well.
Thank you. Be well.